Hey everyone, Dr. Alan Rudolph here. It is February 3rd, 2012, approximately 9 o'clock in the morning. Hopefully everyone's having a good day. And when you're reading this, I just want to update you on some things here. I'm here at the clinic in Mandan now, full time, and pretty much have my desk and everything set up here, which is nice because before I was working out in the back room. So things are going well. Just want to update you on those things, and also that I will be trying to do more of these video presentations on a bi-weekly basis, or I try at least get them out once a month anyways. But one of the things I'd like to do as far as what we're going to speak about today is, especially since it's coming out of winter time, we really haven't had as tough a winter, but one thing that we do have in the winter time is a lack of sunshine. So I want to speak today quickly about vitamin D supplementation. See, vitamin D isn't actually even a vitamin, it's a hormone that's produced in your skin when your skin is exposed to sunlight. Vitamin D has lots of different functions. The one that we're most familiar with is that it helps with the absorption of calcium, but that is by far and by large nowhere near the importance that it plays as far as other functions in the body. One of the largest ones being it has a direct effect on your immune system and the genetic expression of genes that help with the production of different variants that help your immune system to fight off infection. One of those main things that it does is it increases the production of something called antimicrobial peptides. These antimicrobial peptides are basically little proteins that float around your bloodstream, and when they bump into a bacteria or a virus, it helps your immune system to identify that that is foreign, and then your immune system is able to attack it. So the larger or the higher numbers of antimicrobial peptides that you have, the less likely you're going to get sick, because your immune system can identify things faster and kill them before they become an infection and make you sick. It's one of the main reasons why people get sick in the wintertime. It's not because it's cold out. If temperature variance was the indicator or the predictor of what makes you get sick, we should get just as sick in the summertime as we do in the wintertime due to the extreme temperature changes, but we don't. The reason being we don't is in the summertime we have what? We have lots of sunshine, people get outside, are not, it's not as gloomy and cloudy all the time as we tend to experience in the Midwest here during the winter. So keep in mind vitamin D. The recommendations used to be 400 IUs, which is extremely low. They've increased the recommended daily to 2,000 IUs. Personally, I actually recommend that people get 5,000 IUs per day. And when you start to become ill, you can take between 10 to 15 international units or IUs per day. The research that I've read and seen is that you can take up to 25,000 IUs a day for a month, and you wouldn't start to notice any type of side effects until that month has gone by. So you can take very high doses of vitamin D and do just fine with it. They've actually shown in research now that vitamin D, if in the proper amounts, is an indicator or a predictor of being able to decrease your chances of getting all types of cancers, not just one or two. All cancers can be avoided, or your chances of getting them can be significantly decreased by keeping your vitamin D status where it should be. Well, what's cancer? It's cells that don't look like you that are invading your body tissues, and what would be a part of your body or a part of your system that would affect it or would attack cancer cells? Your immune system. And what it modulates or helps your immune system to do its job? Vitamin D. So once again, 5,000 IUs on a daily basis is what I recommend. You can go to, if you don't know where there's a good source to get, you want to make sure that you get the form. It would be vitamin D3. The name would be cholecalciferol. If you have trouble finding those two items, you can go to the website www.nutridyne.com. You can look and research all sorts of nutritional things there. That's a website that I have connected to me. You can actually register and log in. You can register as a patient and use my login or my doctor code, which is 111153. You can become a patient, or you can then basically gain access to the store that's online, and you can order vitamin D3. The type I use is called D3 5000. You can get 120 capsules for about $20, one a day. You're looking at almost 3 months of vitamin D supplementation at a very low cost. I think that's pretty much everything I want to touch on today. We'll look forward to seeing you at the next video conference, and hopefully within the next couple weeks.